welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, I'm so happy to have you here. My name is Brittany and I am a nurse practitioner, and everything on this channel is dedicated to nursing content or being a nurse practitioner. I am also a small business owner, and I created the Brittany Holzbeck NP Review, which has helped thousands of nurse practitioner students pass their licensing exam. If you are interested in my review course, it is all available on my Patreon, and everything will be in the description box below. And then finally, I do have another channel called Brittany Vlogs on YouTube here, and I do things a lot more casually over there. I just started this channel, but I do things more related to lifestyle and motherhood and vlogging. So if it's something you're interested in, that will also be linked in the description box below. All right, so now that we got all of that introductory stuff out of the way, I want to hop into today's topic. It's the first of many videos that I want to do in a segment talking all about rare diseases. I personally am very excited to dive into this segment and do multiple videos discussing various rare diseases. Also, I think it's important to mention there have been multiple times that I've encountered patients that have rare diseases that I'm unfamiliar with. And you can see in them and kind of hear in their tone their lack of expectations. They've probably been greeted so many times with people or other healthcare professionals that are just really unfamiliar with their diagnosis. And so I think it's a really cool opportunity to take time to become more familiar with these rare diseases in the chance that we will meet patients with these, because it will happen in your career and you'll at least have a familiarity with their diagnosis. So there really are quite a few rare diseases out there. It's estimated actually that there are over 100,000, and that's really only the ones that we know about. A really great resource that I stumbled upon when I've been doing research is the National Organization of Rare Diseases, or NORD, N-O-R-D for short. It's a really large database, lots of information, really easy to read resources. If you want to have just a better understanding of your patient and their health history, it's a really good resource to just be familiar with. If there are any specific rare diseases that you're interested in hearing about, go ahead and leave it in the comments down below, and maybe I will cover those in one of my next videos. But all right, so without further ado, and let's just get right into the content. All right, so to begin this segment going over rare diseases, I'm going to start with covering the mucopolysaccharidosis type 3. This is also known as Sanfilipo Syndrome, and this is one of multiple different MPS or mucopolysaccharidosis disorders. And so we're going to get into going over the causes, symptoms, diagnosis, and treatment of this rare disease. So Sanfilippo syndrome, this primarily involves the central nervous system, and it's actually considered a form of childhood dementia. It is rare, it's a genetic condition, and unfortunately it does cause fatal brain damage. This disease is classified as a lysosomal storage disorder, and in these disorders, the normal activity of lysosomes is disrupted. It is estimated that about 1 in every 20,000 live births are affected by a lysosomal storage disorder. So lysosomes, what do? So these house enzymes that are needed to break down and recycle both fats and sugars. And there are 4 specific enzymes that can be affected in Sanfilippo syndrome. You can see them listed here on the screen. I think I'm going to avoid trying to pronounce them just to save myself some embarrassment, because they're a little bit long and wordy there. But definitely go ahead and look at the screen, just kind of reference them so you are building at least a familiarity. In Sanfilippo syndrome, the gene mutations that do occur specifically prevent the breakdown of a specific large complex sugar molecule referred to as heparan sulfate. And so because this sugar molecule is unable to be broken down, it builds up in excess. And so this can actually wreak havoc on a person's central nervous system, which of course we know includes the brain. And so really quickly, you can see how this type of rare disease will greatly diminish a person's quality of life. So what are the symptoms of Sanfilippo syndrome? How do these patients present? So initially, these children appear typical, and signs of developmental delays don't actually become apparent until they're 2 up to about 5 years of age. Generally, a child with Sanfilippo syndrome peaks in both their mental and their motor abilities by 3 up to 6 years of age, and then after which their decline does begin. So typically, it is the child's intellectual abilities that decline before their gross motor abilities diminish. So common symptoms of Sanfilippo syndrome include coarse facial features, severe behavioral disturbances, hirsutism, which we know as male pattern hair growth, sleeping difficulties, speech delays, hernias, coordination and gait disturbances, and also an enlarged liver and or enlarged spleen. And as I already mentioned, it is a fatal disease with the average person living up to 15 to 20 years of age. All right, so let's talk about diagnosis. So an MPS disorder, or that mucopolysaccharidosis disorder, these should be considered in children who present with coarse facial features, liver or spleen enlargement, and bone disease, with or without the presence of central nervous system involvement. However, because we're focusing on the MPS type 3, as I mentioned, this is primarily characterized by central nervous system abnormalities. Musculoskeletal abnormalities can be found or present sometimes in these persons. However, it is less common than it is in other forms of MPS disorders. So some examples of possible musculoskeletal abnormalities include short and thick long bones, slippage of the vertebrae, dorsal kyphosis, and then a large skull due to craniosynostosis. There are various ways in which the diagnosis of Sanfilippo syndrome is confirmed. However, it's generally first discovered with a urine sample, specifically measuring a person's urinary glycosaminoglycan concentration. Lots of big words here. It's possible for urine testing to actually provide us a false negative, however. So if there is a large suspicion for an MPS disorder such as Sanfilippo syndrome, then enzyme analysis should be performed. Also, if there is an abnormal urine result, a diagnosis of an MPS disorder is confirmed using enzyme analysis. And this is identifying those specific enzyme deficiencies. Typically, this is done using a person's peripheral blood leukocytes. Additionally, there is prenatal testing. This can be done. It's generally, however, performed if a person has a family history of MPS disorders. Typically, this would involve either chorionic villus sampling or by an amniocentesis. So far, only testing for MPS type 1 is included in the Uniform Newborn Screening Panel here in the U.S. All right, and then finally, let's talk about treatment for Sanfilippo syndrome. So again, this is unfortunately a fatal disease. There is no cure currently for Sanfilippo syndrome, and treatment is purely both symptomatic and supportive, trying to offer the patient the best quality of life possible. Children with Sanfilippo syndrome, they typically do require care from multitude of specialists, including, not limited to, a neurologist, developmental pediatrician, genetic specialists, orthopedic, gastroenterologist, cardiologist. Lots of different specialists are involved in the care of these patients. There is also enzyme replacement therapy available, but that's only for certain forms of MPS disorders. Currently, it's not available for MPS type 3. Lastly, gene therapy and gene editing. So these are current areas of active research. These could potentially provide more treatments in the future for various MPS disorders. All right, well, that is going to complete today's video. Hopefully you feel a little bit more acquainted and familiar with Sanfilippo syndrome. Again, if there are any rare diseases that you are interested in hearing me cover, go ahead and leave it in the comments down below. I'll definitely check those out. Don't forget to subscribe to the channel, like the video, all those things that YouTube wants to do to keep me going in the algorithm. I really appreciate it. And until next time, I wish you guys nothing but the very best. Don't forget to learn something new every day, and I'll talk to you very soon. Bye.